क्या?
अरे यार,
क्या हुआ?
Shall I start? Hello.
Again, sir.
Good evening to everyone. On behalf of Association for Veterinary Dermatology India, I welcome all of you for this important dermatology webinar. In India, as we all know, India is the largest milk producing country, which is having a cattle population of 192.5 million population as per 2019 census. We had a very big storm of LSD, that is lumpy skin disease in our country, spread from the Africa, Middle East and Europe. And mainly the transmission through the blood-sucking insects, they say. Even it may be a tick or it may be a mosquito or any fly that can transmit the disease. So this particular thing has been creating a lot of problem in our country, and it affected more than 10 lakh cattle in our country. And we had even the mortality rate of more than 45,000 or even nearing 50,000 cattle as per August 31 report. We have lost so many cattle in our country. So it's a very important disease, and it has got we are fortunate enough to have our scientists, particularly we have got the National Research Center of Equine and Indian Veterinary Research Institute, IVRI. They jointly formulated a vaccine, live attenuated vaccine, which is homogeneous, which is going to give 100% protection for lumpy skin disease. That's a very good news for us. And even the field trial has been conducted successfully. So we'll be having it in our hand and we'll be protecting our animals. So with this idea, we thought of going for this webinar with the lumpy skin disease to understand how it is and how it can be managed with the practical way. Even it may be any management is very important because a viral disease, which is a transboundary disease, which is very much important to have it. So it is very, very important to have this idea about this disease, that too with a speaker, which is going to have a lot of input or a lot of idea about the disease, or he faced a lot of cases and successfully managed the cases very well. So we thought of bringing Dr. Sivaraman. Sivaraman is not new for us, and he is very great. Even though he is my student, he became #1 speaker in large animal now. So I appreciate that, and I am very happy to hear that he is doing good job. So he studied in Madras Veterinary College during the year of 1989 to 95. Then he completed post-graduation in 1997 in Manuti Veterinary College, and he joined as assistant professor in TANUVAS 2010. And he has done PhD program in Downer cow syndrome, whereas his MVSc program was with low milk fat syndrome in cattle. And in case of PhD program, he was doing with the Downer cow syndrome, and he is very much interested to treat the Downer cow. And also he has got special interest in ultrasound of udders, and he has done a lot of hands-on training to the field vets. And he is very good in small animal dermatology. That's why he is with us as a joint secretary in our association. And he published more than 70 national and international publications, and founder member for Large Animal Veterinary Association, Tamil Nadu. And he is popularized the microscopic examination of microorganisms like protozoa and other things from the Roman. And he designed specialized movable sling for the Downer cow, and experienced in small animal internal medicine, small ruminant internal medicines, and simplified technique of blood transfusion in field condition. and organized and presented many number of continuing veterinary education programs, and simplified and given hands-on training program on physical procedures, physical method of examination and clinical procedures in large animals, and life member in Indian Society of Veterinary Medicine, and participated even in animal reproduction. He is a life member, and participated in international workshop on adult health care, and experienced in adult health care studies in cow. And he guided two PhD students, two PG students, and as an advisory member for 4 PhD students and 5 PG students. So with this introduction, before I welcoming Dr. Sivaraman, I welcome our INTOS knowledge partners with Dr. Nitin Bhatia and his team, Dr. Amanjot Singh, others, to participate in this, and thanks for your support. And I request Dr. Nitin Bhatia to go for question and answer session, and when he comes on the question and answer, he will ask question, doctor will answer, Sivaraman will answer. I request Dr. Sivaraman to come and start his session. Thank you.
Thank you, sir.
You can share the screen.
Yes. So, available, sir?
Yeah.
Yeah. Respected Nagarajan sir, my teacher and President, Association for Veterinary Dermatology India, and Dr. Nitin Bhatia, INTOS Pharmaceuticals, and all the practicing veterinarians who are attending this webinar, and my dear students who are attending this webinar. I welcome you all, one and all, for the webinar on clinical insight of lumpy skin disease in bovine. So already 2 years back, the lumpy skin disease, the topic was been delivered in webinar, and so many times it has been delivered 2 years back. At that time, we had many number of cases and outbreak in southern part of the states in 2020. Around 2020, we had many number of incidents and cases in southern part of the states. At that time, North Indian part of the states, in North India, in northern part of the states, cases was not there. But in this year, in 2022, there was a huge outbreak in almost many part of the states in northern part of the states. So 2 years back, for all the veterinarians, it was a new thing. Lumpy skin disease was a new thing, and they don't have any full about details about the clinical science and the in-depth knowledge about the things. And now, since they come across many number of cases in day-to-day practice, and huge incidents of outbreak in everywhere, each and every veterinarians who are attending a case of daily 100 cases of lumpy skin disease, everyone is well aware about the clinical science in the field conditions. Anyhow, it is this webinar being organized by the Association of Veterinary Dermatology will document all these lumpy skin disease clinical science. It's a clinical insight on lumpy skin disease. We are going to deal about only the clinical science, management, vaccination, and management of the lumpy skin disease cases. And maybe the newcomers or the new practitioners and the students will be well aware of this disease, so that it will be useful for their future reference. So whenever a case of history of pyrexia with lacrimation and the skin nodules all over the body region, lymphedema with or without skin nodules, brisket edema, all these things are suggestive of lumpy skin disease. So when the lumpy skin disease started in 2 years back as a stray cases here and there, earliest we could be able to feel some difficulty in the diagnosis because there won't be any skin nodules. Only the history of temperature was there, lacrimation will be there. Without skin nodules, there will be lymphedema and brisket edema. Some of the cases has been presented before the outbreak of the disease. At that time, we thought it could be a case of snake inflammation or any other diseases, and we could not able to come to a conclusion. Later, only after getting more number of cases of brisket edema and lymphedema with the skin nodules, we could able to identify it's a case of lumpy skin disease, because it was a new disease to our country. Previously, it was not that. Few years back, before 2020, it was not there in in our country. See here in this scenario, in 2018-19, our country is free from lumpy skin disease, and there is no incidence of lumpy skin disease in our country. And we would have studied only in the textbook about this disease, lumpy skin disease, as a skin nodules, and it has been reported in African countries. But after the scenario of 2020, when it started spreading, and almost in the southern parts of the states 2 years back, and now almost in all the northern part of the states, every veterinarians, they have been experienced in attending the case of lumpy skin disease. And nowadays, it's very easy for the diagnosis. Just by seeing, they can able to diagnose the case, it's a lumpy skin disease. So the scenario of spreading of the disease has been changing year by year, and it's spreading very fast. The etiology of the lumpy skin disease is because of the family Poxviridae. It comes under the genus Capripox virus. And in the sheeppox and the sheeppox and goatpox virus are the two other virus species in this genus. So here the lumpy skin disease is caused by the Poxviridae, the genus of Capripox virus, and the principal method of transmission is by the mechanical transmission. It is believed to be the most of the principal method of transmission is believed to be the mechanical transfer of through the biting insects. The disease outbreak usually occurs during the rainy season, when the insect activity, when the vector population is very high, the disease outbreak is very high in the transmission. The animals can be infected experimentally by inoculation with the material from the cutaneous nodules or blood also, can be experimentally has been reported by inoculations also. And direct contact is considered to be a minor role in the transmission of this virus. Even though the affected animals, they are very nearby and nearby are there, direct contact is believed to be a minor role, but still it's a questionable one. The main role is through the vector population. The vectors which are involved in the transmission of this lumpy skin virus is a stable file, this Culex, and the mosquitoes, the mosquito, the Culex and the Aedes mosquitoes, and ticks also, which causes the spread of this disease, and amblyomma, and this Rhipis cephалus. These ticks are also involved in the transmission of this disease. The risk factor involved in the lumpy skin disease is that all the age groups, all the age group of the cattle are susceptible for this lumpy skin disease. There is no thing that adult one or heifer or calf like that. All age groups of the animals are affected, susceptible to this lumpy skin disease virus. And animals recently recovered from an attack have a solid immunity, and for about a few months. And very young cows, lactating cow, and malnourished cattle develop more severe clinical signs than that of the other animals. And lumpy skin disease is not a zoonotic one. It won't cause any zoonotic effect, and it affects cattle and more in crossbred cows. It has been reported in more in crossbred cows, and also we experience in our attending the cases in native breeds also. In native breeds also, we come across a large number of cases with the severe infection, and skin nodules and limb edema and ventral edema have been reported. The source of the virus it will be present in the skin nodules, scab and crust, and it will be there for more than 35 days. The source of the virus will be there in the skin nodules and the scab and the crust. So we have to take care when handling these animals, and we have to isolate the affected animals. And also the virus can be isolated from blood, saliva, and ocular and nasal discharge, and also from the semen. And the LSD virus is found in the blood as a viremia, which from the 7th to 21 days post-infection at the lower level than the presentation of the skin nodules. Here, the economic importance of lumpy skin disease is the mortality. Even though they say the mortality is very low, I think we would have come across the mortality rate of about 5 to 10%. We had a huge economic loss through mortality and the severe milk production, loss of milk production, and mastitis, occurrence of secondary complications, mastitis, loss of fertility, and abortion in the pregnant animals. There was a huge economic impact and economic loss because of this lumpy skin disease, LSD virus. And the LSD virus is susceptible to certain chemicals. They are susceptible to ether, 20% ether, and 1% chloroform, formalin, and some detergents like sodium sulfate. All these things are susceptible, these LSD viruses are susceptible to these chemicals. And susceptible to the disinfectants. When we come across these things, LSD virus is susceptible to the phenol, 2% phenol for 15 minutes. and 2% or 3% sodium hypochlorite, and iodine components, and Virkon quaternary ammonium components. These are all the components, the disinfectants which are susceptible for the, for the LSD virus. Disinfectants for the LSD virus. And this LSD virus is highly stable and it survives for a longer period in the dry scabs. So they will survive in the for a longer period in the dried scabs, in the skin nodules. And it is LSD virus is very resistant to inactivation, and it will be surviving in the necrotic skin nodules for up to 33 days or more longer for than period. And it is viable for longer period in the environment, particularly in the dark environmental conditions or contaminated the animal sheds. It will be present for many months. The LSD virus will be present for many months, and the virus is susceptible to sunlight and detergents containing lipid solvents. And the morbidity rate varies between 10 to 20% as per the literature, but the mortality rate ranges between 5%, but it could be more than 10% in our country. The pathogenesis involved in the LSD virus, LSD disease and lumpy skin disease, that the virus is transmitted mechanically by the biting insects, by culicoids or by vector, by means of mechanically by vectors, and they rapidly disseminate in the leukocyte-associated viremia, and the keratinocytes, myocytes, fibrocytes, and endothelial cells become infected, which causes the endothelial cell damage, and vasculitis, thrombosis, infarction occurs, edema of the limb, ventral edema occurs, and hence the inflammatory cell infiltrations occurs that will lead to the formation of the skin nodules. So these are all the pathogenesis of the lumpy skin disease virus proliferation. And the clinical signs involved is the incubation period is about 2 to 4 weeks. And first they will be experiencing about the temperature. There will be high temperature will be there, as since it is a viral disease, naturally elevation of the temperature will be there in the first phase. And there will be marked reduction in the milk yield in the lactating cattle. And there will be depression, anorexia, and emaciation. And some cases will be having lacrimation, conjunctivitis, rhinitis. These are the early signs. And enlarged lymph nodes will be noticed. After the onset of the temperature, there will be enlarged lymph nodes will be there. And immediately what we will be thinking, since it is having a large outbreak, we know this is a case of lumpy skin disease. When during the early phase of outbreak, we could have missed these cases like ephemeral fever. As when we are coming across a case of a temperature with the lymph node enlargement and mucous membrane, congested mucous membrane, we will be thinking about ephemeral fever. After a few days, it will be showing that eruptions of skin nodules, because lacrimation will be there, nasal discharge will be there. So here lacrimation will be noticed, and the cutaneous nodules of about 2 to 5 centimeters in diameter will be developed, particularly in all the areas of the body, especially in the head, neck, limbs, udder, genitalia, perineum, all these things within the 48 hours of the onset of the febrile reactions. So the farmers, during the early phase of the outbreak, they feared a lot because of the presence of the skin nodules all over the body region. Immediately after the onset of the fever, formation of the cutaneous nodules, they get panic, very much panic, when we first come across the outbreak as before 2 years back. And the nodules are of circumscribed and firm and round, raised in nature, which involves the skin and the subcutaneous tissues also. Not only it is having a dermis and epidermis also. These nodules, sometimes we have seen many number of cases. I will show you the pictures, and it involved in the subcutaneous tissues also, and it sometimes even the underlying muscles also involved these things. And this type of lesions we come across in many number of cases. This is called a sit-fast. Large nodules which may become very much necrotic in nature and fibrotic in nature, and they will persist for months. Even after recovery, they will persist in that cattle, that animal, for months. That is called, this is the lesion, this is called a sit-fast. The scars remain for a longer period in the affected animals. And cutaneous nodules are noticed all over the body region, and small nodules are large type of nodules. Small nodules may resolve spontaneously without any treatment, spontaneously, slowly it will resolve. Large type of nodules which may complicated to a maggot wound, or it may complicated to the sit-fast like lesions, may persist for a longer period. Vesicles, erosions, and ulcers may develop in the mucous membrane of the mouth and the alimentary tract, and even in the trachea and the lungs are also be noticed. Here we can able to appreciate the small and large number of nodules all over the body region. So here you can able to appreciate large number of nodules throughout the body region. And here this animal is severely affected with the LSD, and almost entire part of the body is affected, and with a small and large number of nodules. The animal is completely anorectic and emaciated. And here you can able to appreciate the oral lesions. The nodules are present in the inner aspect of the dental pad also. Inner aspect of the dental pad and oral ulcers also noticed. And the lesions are also noticed in the muscle. And whenever you come across a few stray cases, we'll get confused of some other cases that we'll be seeing in differential diagnosis. Here you can able to see the nodular lesions all over the body region, and there is no specific region of anterior or posterior. The entire body will be affected with the nodular lesions. And the limbs and other ventral aspects of the body, such as the dewlap, brisket region, scrotum, vulva, they become edematous and causing the animal reluctant to move, and the animal will be very much having pain and anorectic. And here you can able to see the brisket edema. Here you can able to see the brisket edema. And when during the early part of the outbreak, whenever the case is presented with the brisket edema without skin lesions, we get confused because of it could be a case of some pericarditis or some other things. In pericarditis, there will be jugular vein engorgement will be there, positive venous stasis will be there. Here there is no jugular vein engorgement or no positive venous stasis, and nothing will be there. Everything will be normal, and except the brisket edema will be developed. And later the nodules, small eruptions and nodules will be developed. Some cases we have seen without the skin nodules, brisket edema and limb edema, and slowly the disease has been subsided. That type of cases also we have seen in the field conditions. And here I can able to see the brisket edema with severe lymphadenopathy. The lymph nodes are very much enlarged. So whenever you will come across a temperature with the brisket edema and without skin nodules, we will be suspecting a case of pseudopericarditis, which could be due to a case of theileriosis, theileria, which causes pseudopericarditis. So when we are coming across a large number of outbreaks, we can able to easily diagnose this type of cases. So here there is a brisket edema with the lymphadenopathy, and the edematous dewlap, edematous swelling in the brisket region and the dewlap region was noticed, and without skin nodules. That is also a case of lumpy skin disease. And the nodules involved in the epidermis, dermis, and also extend to the subcutaneous tissues. See here, you can able to see the small nodular eruptions and subcutaneously, and they are involved in the subcutaneous swelling also. When you palpate the muscles, the swelling might have involved in the subcutaneous muscles also. This type of swelling and these nodules will be a complicated one, and sometimes they may lead to cellulitis, and the rupture of the nodules will lead to attraction of the flies, and maggot wound will attract. Especially in the limb, the cellulitis is, the complication of cellulitis is more common in the limbs when we come across the limb edema. So here we can able to see the small eruptions throughout the neck region and the body region, which peels off and which forms a nodular like lesions. And here also you can able to appreciate a small nodular and big nodular lesions throughout the body lesion with the limb edema, and the nodular lesions in the dorsal aspect of the body and ventral aspect of the body also. And lesions are noticed in the spinal cord region. I have seen some of the cases. The lesions are noticed in the spinal cord region, and the lesions and the nodules get ruptured, and it gets infected with the spinal cord. And many of the cattle, they lost the tail wagging capacity, and it's not like a lumbar paralysis. It's almost like a lumbar paralysis. The animal will be standing, everything normal, but it cannot able to lift the tail, and the animal will be passing the dung involuntarily. In some of the after effect of the LSD cases, I have seen some cases, you cannot able to elevate the tail, and that they will pass the dung without elevation of the tail, and involuntarily they will pass the dung. Like that cases also we have seen. And it's especially you can able to appreciate the limb edema, and here also you can appreciate the small nodules, eruptions, nodular eruptions throughout the body and in the limbs. So whenever you are coming across a cases of limb edema alone, without nodular eruptions, we will be thinking about hypoproteinemia and snake envenomation in large animals. We used to think about as a differential diagnosis. And during this type of outbreak, we came to see a lot of cases of limb edema and brisket edema cases, with or without nodular lesions. And here you can able to see the small eruptions and the nodular lesions through the perineum and also in the tail region, and in the limb also we can able to see. and the ventral part of the body, ventral edema has been noticed. And one of the peculiar things in LSD, many times, many number of cases have been reported with the lymphedema and ventral part of the edema, ventral edema. So this time also, without nodular lesions, we can able to differentiate. Now also we are getting some cases with the ventral edema. For the past few months, we can able to see here and there the strain number of cases with the ventral edema alone without any nodular lesions. So whenever you come across a case of ventral edema and lymphedema without nodular lesions also, we have to think about the lumpy skin disease. And the nodules with the swelling is being noticed, and the nodules with the subcutaneous swelling is being noticed. And LSD is being reported in many number of calves, irrespective of their age. And in calves, the lesions are very much severely affected. In calves, the lesions are very much severely distributed, and you can able to see the nodular lesions in the oral cavity, and the lacrimation is noticed. And you can able to see the nodular lesions in the eyelids and also in the nostrils, and throughout the body. It will be you can able to notice. And here you can able to notice the nodular lesions in the nasal cavity, nostrils, and also in the eyelids. And you can able to appreciate the lesions in the muscle also, severe ulcerated and nodular lesions in the muscle also. And in adult animal, in the udder also, we can able to appreciate the lesions. In some cases, we could able to get the lesions in the udder and the teeth. The nodular lesions in the teeth will be also noticed and been documented. And it attracts all these, as already we told, the sit fast, this type of lesions, they will attract the fly, and they will get complicated of a case of maggot wound. They will attract flies and get complicated of a maggot wound will be a sequelae of this LSD lesions. And the lesions are noticed in the inner aspect of the nodule. Sometimes they started bleeding also. And the corneal opacity has also been recorded in many number of cases in the field conditions. And corneal opacity, bilateral corneal opacity, and inflammatory swelling of the facial swelling has been also documented. Here you can able to see the swelling in the face, eyelids, and the base of the ear, and the corneal opacity has been also recorded. And the inner aspect of the nostrils, and the serous fluid, and the serous, sometimes serosanguinous nasal discharge will be noticed in the complicated cases. Here you can able to see the difference of the limb swelling is noticed. Here you can able to see the normal limb, and here you can able to see the edematous limb. Sometimes there may be noticed in the bilateral limb edema is being noticed. Sometimes unilateral limb edema. It varies according to the individual cases. And necrotic skin plugs are noticed, and it will be persist for many number of many days or months. And ventral edema is being noticed. And you can also notice the skin lesions as noticed in the perineum and also in the scrotal region. So animals which are affected, the bulls which are affected from lumpy skin disease are permanently, they become permanently affected, infertile. And the semen from the affected bull should not be used for artificial insemination, and it should be kept isolated. And the lumpy skin disease virus will be present in the semen for a prolonged period in affected bulls. In pregnant cows, it may abort, and it may go for infertility for many months. And recovery from severe infection is slow due to emaciation, secondary complications like pneumonia, mastitis, and necrotic plaques, secondary bacterial invasion, and recovery from the severe infection is being noticed in many number of cases. And death could be more number of, we have come across many number of deaths due to the secondary complications. And the necrotic plugs are subject to fly strike and shed, leaving deep holes in the hides. Here is a very interesting case. The literature says that lumpy skin disease causes abortion. And here you can able to see the aborted fetus. In the aborted fetus also, you can able to see the nodular like lesions throughout the body region. One of our Dr. Desing Raja from Tamil Nadu has documented this picture. And you can able to appreciate the nodular lesions in the throughout the body region in the aborted fetus. So the diagnosis, just during the pandemic or huge spread of the disease, the diagnosis simply by means of clinical science, and the confirmation diagnosis by means of viral isolation by PCR, and also by the intracytoplasmic inclusion bodies histologically has also been, we can able to identify this type of condition, disease. And in serology, viral neutralization is the standard, gold standard test, and Western blot analysis, indirect fluorescent antibody test. So as a clinical people, when we are coming across this case in the field condition, just by clinical science, we are able to diagnose this type of cases, and we follow the treatment and management of this type of diseases. And samples should be collected. I will be seeing what are the samples to be collected for documenting this disease. And here you can able to see the intracytoplasmic inclusion bodies. So here you can take the skin biopsy. So as a dermatologist, you can able to see, take the skin biopsy, and in the histopathology, you can able to appreciate the intracytoplasmic inclusion bodies. Intracytoplasmic inclusion bodies, which are the classical thing for the LSD, lumpy skin disease. You can able to see here. The arrow mark shows that the intracytoplasmic inclusion bodies are there. So this type of things also will be helpful for the diagnostic aspect. So the differential diagnosis includes bovine herpes mammalitis, herpes viral infection, bovine papilla stomatitis by parapox virus, and dermatophylosis, demodicosis, any insect bite or sting by bestnatiosis, photosensitization, urticaria, and onchocercosis. So when we had a huge number of cases, or when there is a large number of outbreak, diagnosis is very easy. And whenever you are getting a stray case, individual case, 1 or 2 cases here and there only, then only will be getting a confusion, and it will be going for the differential diagnosis of this type of conditions. Otherwise, there won't be any difficulty in going for the diagnosis of this case. For example, dermatophylosis. In case of dermatophylosis, the skin lesions will be matted or paintbrush-like appearance will be there in the foot region. The skin lesions will start from the fetlock region, and it will be ascending from the fetlock region towards the limbs, and ascending toward the limbs, ascending part of the limbs, and a paintbrush-like appearance will be there. Matted hairs will be there. That is due to dermatophilous conglomerasis. That is a dermatophylosis. In that case, there won't be any nodules. There won't be any nodules or lymphadenopathy or nothing will be there. And in such a cases, you can easily differentiate. In demodicosis, only in demodicosis, you'll be getting some difficulty in type of seeing having a differential diagnosis. In demodicosis, the nodules will be very much smaller in nature. Very much small nodules will be in nature. When you go for the skin scraping, the nodules will be ruptured, and the pustular nodules is a common thing in the demodicosis, bovine demodicosis. Unlike in dog, demodicosis will be having erythematous lesions in dog. Here it's a pustular lesions in demodicosis. Sometimes we come across a case of recently pustular nodules throughout the body region, suspected like a LSD. But when you get a scraping, we could able to find out a large number of demodex from the nodules. That is demodicosis. And the photosensitization will be particularly through the external aspect of the body, and peeling of the skin will be noticed, and it will be an individual case, not a many number of cases will be there. And onchocercosis also, a small tubular nodular like structures will be there, and the blood will be oozing out from there, and you can able to you can able to make an impression smear from that. You can able to identify the filariasis, onchocercosis from that lesions. So these are all the differential diagnoses of lumpy skin disease. When there is a outbreak or a pandemic attending a large number of cases, we can able to identify very easily by clinical science itself. And regarding the treatment and management, there is no specific treatment available for the lumpy skin disease since it is a viral disease, and we have to go for the control of the secondary bacterial infection with antibiotics are recommended. Symptomatic treatment is being done. So I hope many veterinarians are well versed in treating huge number of cases daily. 20 to 30 number of cases are attending a lumpy skin disease camp and attending a huge mass of cases of 50 cases or 100 cases, and you will be getting a lot of experience in your practice. And to counteract the secondary bacterial infection, we can use certain broad spectrum antibiotics like streptopenicillin can be used. You can use enrofloxacin, sulfonamides can be used, or ceftriaxone, all these antibiotic, broad spectrum antibiotics can be used to counteract the secondary bacterial infection and to complications of cellulitis and the nodular lesions and the complications of the nodular lesions, the healing of the nodular lesions will be enhanced by using these antibiotics. And when there is any severe inflammatory swelling like cellulitis, when the animal is having respiratory distress or inflammatory swelling is there or lymphedema is there, you can use anti-inflammatory drugs like flunixin or ketoprofen or phenylbutazone. Any one of the anti-inflammatory drugs can be used as antipyretic and also the anti-inflammatory therapy. And when you are going for more than 2 days or 3 days of anti-inflammatory therapy, you combine the treatment with pantoprazole 40 to 80 milligram intravenously to prevent abomasal ulcers. And diuretics can be given if edema presents. For example, whenever you are attending a case of ventral edema or when you are attending a case of lymphedema, so we can use the diuretics. We can use the diuretics for 1 or 2 days symptomatically. That will also be given a fruitful therapy. And the supportive therapy with the B complex and the supportive therapy with the vitamin B complex. And you can give vitamin A, D in alternate days as vitamin A, D as antioxidant, and it will enhance the easy healing of the skin lesions. And also we can use vitamin C in some of the cases with a severe wound and lymphangitis. You can use vitamin C injections. Intravenously you can use. And ivermectin can also be used to control myiasis. And injection levamisole at the rate of 2.5 milligram, not to 2 to 5 milligram. So 2.5, you can read it as 2.5 milligram per kg body weight subcutaneously is being used to improve the immunity of the animal. And whenever the animal is anorectic, we can also go for the fluid therapy in the needed cases. So when there is any severe pneumonic signs and all, according to the individual conditions, we can see and we can decide the quantum of the fluids for the individual cases. In anorectic cases, fluid therapy can also be given. And especially in calves, debilitated calves, neonatal calves, which are more severely affected with the lumpy skin diseases, we can go for the fluid therapy with the broad spectrum antibiotics and the supportive therapy with the B complex, vitamin C, and we can able to overcome the mortality up to a certain extent, and we can expect fast recovery from these cases. And some of these cases, this type of cases, many number of veterinarians could have been experienced in the field conditions like cellulitis, after effect of the lumpy skin diseases, which forms a lymphedema, and the cellulitis, which causes severe lymphangitis and cellulitis. And it will be very much difficult to heal. It will take a long period. A proper wound dressing management should be carried out. This type of complications in the foot lesions are very common during this type of seasonal outbreaks has been reported. And this type of wound complications in many parts of the body, in the lateral aspect of the body, hind limbs, forelimbs are being reported, and it takes a long period for the treating these type of lesions. And the wound management is very, very important. Many type of commercial preparations of wound sprays, wound management sprays or commercial sprays are available that we can use, and the proper wound dressing should be there. And the wound should be perfectly washed with the potassium permanganate lotion, and we have to apply with the Bovine iodine, and the wound dressing can be given daily. And you can apply zinc oxide ointment or boric oxide ointment will be very much helpful for the fast healing of this type of wound management. It will take minimum about 2 to 3 weeks for the recovery from this type of lesions. And some of the ethno-veterinary preparations are also available. During when we had outbreak, when we are attending a large number of cases in the villages, we used to get many number of cases daily, 20 to 30 cases daily they used to attend. And minimum in a week, we will be attending 100 to 200 cases in a week. So managing all this type of huge population, use of ethno-veterinary preparations will be very much useful for the healing of the lesions. We can advise the farmers. So we used to advise the farmers to apply the neem leaves with the turmeric, mix it with the turmeric neem leaves. You can taste the, you can take the neem leaves and make it as a paste, and you add turmeric, and you can ask the farmers to apply over the nodular lesions and throughout the body region, and it will enhance the fast healing within few days or few weeks. And excellent results have been noticed during the outbreak of the cases. And another combinations, we used to say that the euphorbia, thymofolia, tulasi, neem leaves, garlic, and turmeric. This is the combination. These combinations, you can make it as a paste and you can apply over the lesions and it will be very much effective. So this is in Tamil, we used to call as Aman Pacharisi, and it is botanical name is Euphorbia thymifolia, and it is available in all the villages and the roadside. It is easily available in all the parts of the country, and it is available in the roadside and in the field also very commonly available. And the other plant is the Tulasi plant, Tulasi, and neem leaves. It is also very easily available in all the parts of the area. And the turmeric, we can mix it all these things as a paste, and you can apply over the nodular lesions throughout the body. Can be, and this type of lesions we can apply throughout the body region whenever there is a presence of nodules. And these are all the healing lesions, and excellent results have been noticed. Apart from our line of treatment, you can also give this ethnoveterinary preparation as a supportive treatment for the farmers, so that the faster wound healing will be noticed. See here, they have applied throughout the body region, and the wound healing process is very fast. And this type of lesions have also been noticed in calves, the after effect of LSD. And here, the after effect of the LSD, and the lesions, they form as a scare-like formation. So throughout the body, scare-like, permanent scare-like formation will be also noticed. Most of the animals, they will get healed and the lesions will go off. We cannot able to appreciate the scare. But in some cases, especially in calf, severely affected, we can able to appreciate the scare-like lesions even after the recovery phase. And some of the alternative medicines, like as already told, the ethnoveterinary preparations, some preparations of homeo preparations are also very much effective. And during the, when you come across a large number of cases, we have got very good results by using these combinations of Beryllium, Delcamara, acid nitricum, Osimum sanctum, Thuja, Calendula. And these preparations gave very good results in containing the lesions of the LSD. See, this is a case of this type of lesions are noticed all over the body region, and this is only treated with some alternative medicine treatment, and this is the thing after the recovery, after treatment. Just 1 or 2 days, we'll be giving antibiotic therapy and anti-inflammatory and supportive therapy, followed by alternative medicines, alternative therapy, and complete recovery of the lesions have been noticed. And this is the case, this type of cases, nodular lesions, after 10 days or 2 weeks, after 10 to 14 days, there's a complete recovery from this type of lesions due to the use of combined use of alternative therapy. Apart from our regular therapy, alternative therapy also can lead to the complete healing of the lesions. And what are the materials you can able to for collecting and documenting of this type of lumpy skin disease virus? We have to collect the whole blood. You have to collect the whole blood. You have to collect the serum and the swabs of the ocular, nasal, and oral. And from the swabs and ocular, nasal, and oral swabs can be taken. And the skin nodule or scab are the best thing which harvest more virus for the identification of this disease. And these things can be collected and you can send it to the competent laboratories for high security animal disease diagnostic laboratory Bhopal. The skin nodules, the skin biopsy or the skin scabs, 4 to 5 numbers can be taken and add with 4 to 5 ml of phosphate buffer saline and add 1 or 2 ml of streptopenicillin, and you can send it in a airtight container. If your shipping is more than 48 hours, you can send it in dry ice. And the skin nodules, whole blood, and serum are the preferable samples for collecting these samples. And LSD virus is found in the blood intermittently from 7 to 21 days post-infection at the lower levels, and it is present in the skin nodules, more present in the skin nodules for more number of days. And regarding the prevention and control, the restriction of the movement is the main thing, and the removal of the infected animal from the premises and proper disposal of the dead animals. Suppose we are having a farm, some 20 animals are affected in a farm, remaining some 80 animals are there in the farm. You isolate the affected animals, the 20 animals, and so that you can restrict the movement of the affected animals so that you can manage it from prevent the occurrence of the disease from the other animals. Yeah, I have seen some of the farmers, they are using a large net nowadays. They are using a large net in a household thing to prevent the vector population. So that also it has given some fruitful results in the field conditions. They have kept the animal in the huge net in the cattle shed to prevent the vector population. And regarding the vaccination, there are two types of vaccines are available. One is the homogeneous vaccine, that is the lumpy skin disease virus, live attenuated vaccines, which has been recently launched. When in such a vaccines, homologous LSD vaccine is available, you can go for the use of LSD vaccines. If LSD vaccines is not available and you want to contain, I want to have a protective, I mean, you want to give a protective thing for non-affected animals, you can go for the heterologous vaccines like sheeppox and goatpox vaccines can also be used. Sheeppox and goatpox virus live attenuated vaccines can also be used. And sometimes it may have some few cases has been reported when we are injecting, go for the vaccination, the local reaction has been noticed. Otherwise, there is no harm in using sheeppox or goatpox vaccines. And the live attenuated vaccines, they produce longer immunity for a period. And the frequently asked questions are when I should vaccinate to do the vaccine for the lumpy skin disease virus. Annual vaccination is recommended nowadays. Annual vaccination of the adult cattle will protect the animals from the lumpy skin disease. And calves from the vaccinated animals, already vaccinated animal, already vaccinated with the lumpy skin disease virus or sheeppox or goatpox or naturally infected cattle. And the calves which are born from that animal, they should be vaccinated at the age of 3 to 6 months of age. Calves which are from unvaccinated cattle can be vaccinated at any age. And the newly purchased animals, they should be vaccinated 28 days before introduction to the herd. For example, they'll be getting a new animal from outside during the outbreak. So there won't be any outbreak in a particular farm. They want to introduce some few animals. You have to vaccinate the other animals and you have to keep it isolated for a few days, 14 days. And then after 14 to 28 days, you can introduce the animals so that you can prevent the occurrence in the farm. The animals shall be vaccinated 28 days before transport or movement to the another places. And regarding the dosage and all, the dosage is same as cattle fund for all the animals. And the lumpy skin disease virus has not been reported in sheep and goat. It is not been reported in sheep and goat. It is reported only in cattle. And in cattle, the dose, some literature says some companies, for example, some companies marketing goatpox vaccine, they used to say as a 3 ml subcutaneous. Otherwise, you follow the literature, what the company says. And generally, and otherwise, if you are using a goatpox vaccine or a sheeppox vaccine, 1 ml is sufficient and you can give subcutaneous and it gives a very good immunity. And we have given for any number of cases and we have got a very good results in the field conditions. And whether we can vaccinate the pregnant animals, yes, we can vaccinate the pregnant animals and we can vaccinate the healthy cows and the heifers also can be vaccinated. How many doses of lumpy skin disease virus have to be? A single dose of vaccine will give immunity for 1 year. So annual vaccination is recommended. Use a disposable syringe for every vaccine. Don't use the same vaccine for all the animals. Each and every single needle and disposable things should be used for. Can vaccinated animals get still lumpy skin disease virus infection? Yes, suppose when the animal is in the subclinical stage or incubation stage, during the time of the vaccination, there is a possibility of the onset of the disease. When we are vaccinating an animal, they will produce the immunity after 14 to 28 days. So then only the immunity will be produced. In the meantime, when the animal is in the subclinical stage or during the incubation stage, they may exhibit the clinical signs. There may be the possibilities. So with this, I conclude this session, and I would like to acknowledge Dr. Meera P. Sakre from Maharashtra and Dr. Desingi Raja from Tamil Nadu and Dr. Amarpreet Banu from Punjab and Dr. Karthik Kumar from Tamil Nadu for sharing some of the pictures and valuable inputs for this session. And I thank you very much for attending this webinar. We can have a discussion.
A nice session by Dr. Sivaraman. Hope I'm audible.
Yes, sir.
It is good to have you on the Teachers' Day, a person who has been working in clinical practice, looking into the expansion of the same into the livestock and taking it down to the field veterinarians to the utmost extent. I think we have with us Dr. Pannu also, if since Dr. Sivaraman has already applauded his contribution, so I will request Dr. Panu to say a few words on LSD in case he's live. I'll open you on the chat box and then we'll have the question answers. Dr. Panna? Dr. Amarpreet, are you there?
Yes, he is there.
Yeah, he's there. That's why. Okay, let me take a few questions and then we come down to if he's available that time.
I can able to see the chat box, whether I can read or you will be.
Yeah. I'll read it for you. The first question which came up from people was, is it also a disease of buffaloes? Which I responded, yes. You can further emphasize on it. We saw reports in this year in buffalo. So over to Dr. Shivan.
Yeah, buffalo, but they say it affects cattle and buffaloes, but less incidents are seen in buffaloes. The severity of the lesions or the severity of the disease is very less. And I have inquired with many number of practitioners also, and also in our clinical field practice, I have not seen typical lesions in buffaloes.
Right. Can we use ivermectin along with goatpox vaccine simultaneously?
Simultaneously, we can. Yeah, simultaneously. There is no harm in using ivermectin and goatpox vaccine. No untoward reactions will be there. Ivermectin will have a separate effect on meiosis. That's all.
What is the reason behind udder edema or brisket edema?
Due to the lymphangitis, lymphatic drainage block, there will be lymphedema and ventral edema are being reported. And the early stage, we used to get confused with many number of differential diagnoses. And now during the time of outbreak, we can able to easily identify this type of clinical conditions. This is mainly due to the infiltration, lymphangitis and the lymphadenopathy, lymphatic drainage block.
Right. Can LSD be transmitted through pregnancy or in vitro, in utero?
Literature says it causes abortion, but I have shown on picture that aborted fetus with full of nodules. That shows that it has been affecting the fetus also.
Right.
Yes, it can be transmitted through uterus also.
Uterus also.
That is what they ask. That's why it has got nodules in the fetus.
Yes,
right.
Even as Dr. Sivaraman was telling, even it can spread through semen also. Okay.
There's a question from Dr. Mangesh. In some cases, we have observed no pyrexia, but presence of cutaneous nodules.
Yes, sir.
Is it typical of LSD or it can be seen?
Yeah. Pyrexia could be there, but they might have gone unnoticed. Earlier stage of the phase of viremia, they would have missed that viremia stage. And later it would have developed the skin nodules. The owner might have, the farmer would have seen only at the time of skin nodule formations. But anytime pyrexia will be there, after that only skin nodules will be present.
In few cases, we have seen acute death. What could be the pathogenesis be like?
Yes, sir. Yes, sir. And we also come across many number of cases that could be secondary complications. LSD, when there is a sudden death, there could be some secondary complications with pasteurella or anemia hemolytica or some other secondary complications which would have aggravated the conditions and caused secondary, acute death.
Right. There's a question from the Eastern Belt. He says that we came across internal nodules in the GI tract in LSD postmortem. So.
Yes, sir. Yes, that is also very common. And since we cannot able to appreciate only in the postmortem lesions, many literature says they have appreciated the nodules in the entire respiratory tract and the GI tract also nodules have been reported. There are also possibilities. Because of that pain and the severity, the animal won't take feed and reduce the intake of feed with there. The animal will go for anorexia. In such a cases, you can go for the parenteral fluid therapy treatment. You can manage the cases. Internal lesions may also be possible.
We have a next question. I think it is not very relevant to Dr. Sivaraman, but if he can answer. Why it is the major reason for mortality in cattle in this year in Gujarat, Rajasthan and UP, while it has not happened in southern India earlier?
So maybe climatic changes and many factors have been involved. We have to go into the in-depth of the analysis, then only we can able to come to our conclusions. And we have to analyze the samples and then only we can able to say what could be the exact cause of mortality reasons. Of course, as you asked, when we had many number of cases 2 years back, the mortality was very much less just by giving the alternative medicines itself, which having a very good recovery. But now the recent outbreak, we are having a conversation with many field veterinarians. I used to get many number of calls from our friends from Punjab, Gujarat, and Rajasthan. They used to share their practice experience, and mortality is very much high. So that we have to get the analysis, what could be the exact reason, whether it could be a case of secondary complications or not.
And truly speaking, there are no outbreaks this year in Tamil Nadu, right?
Yes, sir. But the stray cases here and there, they without any lesions. Yeah. No outbreak.
Yeah. The next question is there any risk to wildlife, especially ungulates or any other animals? Is it transmission?
Literature says it has been reported in wildlife also.
Outside India or?
I don't know, sir. I have no idea about that.
Okay. Does hepatic stress elevate LSD condition?
Which one?
Hepatic stress.
Hepatic stress.
I think it does, but over to you.
They asked a question like that.
Yeah.
Okay. So any viremia would be lead to any stress of the organs. So naturally it will relate to the immune system, and it will trigger all these things. And during the viremia stage and all, the animal will be in the stress conditions. No, so you have to overcome these things with any supportive treatment. That's it.
The next question is, sir, how long to treat a case of LSD?
Yes, sir. That is a question. Very good question. Because the lesions will be present for more than 2 to 3 weeks. The farmer will be telling, for example, when there is some pox-like conditions is there. According to the farmer, the recovery of the disease will be recovery of the lesions, complete recovery of the lesions. Then only they come to know that the disease has gone. So we have to enlighten the farmers that the disease can be contained for within 1 to 2 weeks, and the treatment can be enough for 3 to 5 days. That's more than sufficient. According to the clinical conditions, we can decide it for 3 to 5 days. And the nodular lesions will subside within 2 to 3 weeks only. Once the animal started taking feed, everything, we can stop the treatment and all. The nodular lesions will regress slowly.
Right, sir. Sir, what could be the line of treatment for corneal opacity?
Corneal opacity, yes. That is complications in few cases, very few cases. Just we can apply some antibiotic ointments like Neosporin eye ointment, any ophthalmic ointment or ciprofloxacin eye ointment, just for 1 or 2 weeks. Slowly it will regress. That can be also. That's
how about the zoonosis part of it? Is it transmissible to humans?
It's not a zoonotic. LSD is not a zoonotic one. So that is.
But it doesn't go into milk and all?
It's not a zoonotic one.
Yeah. Okay. Amarpreet, are you there now?
Yes, sir.
Yeah, you can also narrate your experiences since Dr. Sivaraman has also shared your experiences. So we request you to also to share your experiences with LSD. Over to you. Yeah. In case you can share a video, it is better. Otherwise, if you may be in an odd situation, then it is okay.
I will share my experiences.
Up to you.
The disease started almost 1 month, 1.5 months back in Punjab. And when in the beginning, we used antibiotics, as we are not having much experience of the disease, like in South. And but in recovery was more faster in cases where we used less of antibiotics, like only vitamin C daily, 30 ml intravenous, and levomazole and CPM. But after 5th to 7th day, when we started giving antibiotics, then there was a good recovery because of prevention of secondary infection, bacterial infection. And only cases that were worsened due to the high fever in some cases. And we even did
Hello.
When treatment for arthritis, even animal earlier than we were expecting the recovery. So maybe LSD have already weakened the immunity, And overuse of antibiotics did the damage in most of cases, I think. And when we normally used, most of the veterinarians used less of antibiotics. That was the reason for survival of animals. Cases went to veterinarians, veterinary officers of Punjab. And vitamin C, I think vitamin C, CPM, levamisole, and good plane of nutrition. Those animals which keep on eating and did not become off-feed, that was, in that case, the recovery was seen in even 10 days. And these were my experiences with that disease.
Yeah. Any experiences with buffaloes?
I have not seen any case in buffalo.
Okay.
And some of my other vets from other districts told me, and 1 or 2 cases in seen. But even that, they sent the sample, and that sample was negative for LSD. So it shows a buffalo is not susceptible to the disease. And I think they may have a immunity against this disease. Otherwise, in one farm, we see 5 buffaloes and 5 cows in the same farm.
Right. I think we have addressed on to all the questions broadly.
Sir,
But still,
Amar sir,
Nothing else.
what have you used any vaccines?
Yes. Actually, when the disease started in Punjab, the Punjab government in a very fast way gave us the goatpox vaccine. Okay. And at that time, we were apprehensive while using goatpox in houses where there were 2 cases of LSD and other animals were healthy. And we started giving vaccine to the healthy animals, even in same house where there was cases of LSD. And there was wonderful results seen with the vaccination of goatpox.
How much, what is the dose you have used?
We gave 3 ml from Hester company, 3 ml subcut. Yes, I think the simple reason for this is that it is a goatpox vaccine heterologous, not homologous. Yes. Maybe that I have not done anything wrong to the animals. In already some incubation period animals may be there, but very good results. I think the Punjab controlled the disease very well with the goatpox vaccine.
Yes, yes. One question they have asked about the ml dose of vaccine. They have asked the question. The company, as the company suggests, you can use the 3 ml as a company suggests. Otherwise, when you are using the goatpox vaccine alone, you can use about 1 to 2 ml. That can be also be used, no problem. Just to clarify, I told.
Yes.
We have a few people who want to ask. So, if we have Dr. Ravinder, if you can talk. All those people who have raised their hands can talk one after the another.
You have to unmute.
Yeah, I have unmuted. They have to unmute.
Yeah, they have to unmute. Yeah, Vinod.
Yes. Good evening, sir. Hello.
Good evening, sir.
Sir,
am I audible?
Yeah.
Yes,
yeah. I'm Dr. Vinod Chaun, MSc in veterinary medicine, working as a livestock development officer in Aurangabad district. I have 1, 2, 3 questions. First is for dose regarding the dose of goatpox vaccine. Companies suggest 3 ml, but they have also no any literature. So any literature or any such case studies are there regarding dose of goatpox vaccine?
Yes, sir. There is this is a long question for many number of months. Many veterinarians they are asking, no. So according to our experience, only we can able to say there is no literature says that this much of ml like OAE, or they are not telling. They are suggesting just goatpox vaccine or sheeppox vaccine. They are not telling about ml. So that's why when it is a vaccine from any company, we can follow that company's recommendations, how much ml. Otherwise, when you are using the other vaccines, apart from that goatpox vaccine or sheeppox vaccine, we can use 1 to 2 ml during this type of, when we had an outbreak, we have used successfully. That's why I'm sharing that. There is no specific literature says.
Yes, I am working on the outbreak. I have 5 cases in my jurisdiction. So we have made the epicenter, and all the animals in the epicenter, 5 kilometers of epicenter, we are vaccinating. But there was a controversy regarding the goat pox vaccine dose. So that is thing. So I think there is a need to study to do the study regarding the dose rate for the cattle, large animal.
Yes, sir. Yes, sir.
Okay.
Yeah, over to Dr. Malik if he's around.
Sir, good evening.
Good evening.
Good evening, sir.
Dr. Ravindra Malik, Deputy Director IT from Jaipur, Rajasthan. Sir, I have seen plenty of cases of lumpy. Sir, what is the main reason of swelling in forelimbs, in upper forelimbs, which is very common, and the cases where the swelling was more, they got worsened?
Yes, sir. Yes, sir. The swelling in the forelimb, sir, the swelling in the forelimb is mainly due to the lymphatic drainage block and the lymphadenoma, sir. And so only we are getting many number of cases in the as a lymphedema. It's one of the complications, sir. That's in LSD. A few cases.
Sir, the cases where the lymphatic drainage was blocked, and they have got more secondary complications such as respiratory tract infections and other systems involved.
Yes, sir. Yes, sir.
Sir, there is one more question. How much is the length of viremia in case of this lumpy skin disease?
Viremia will be there for 2 to 3 days, sir. Viremia will be there for 2 to 3 days. In the meantime, skin nodular lesions will start eruptions. They will be there.
Okay, sir. When should we start intervening the treatment?
Once the onset of the disease, when the farmer is reporting that the animal is not taking feed, we can initiate the treatment. So we can initiate the treatment, but we cannot able to appreciate the lesions. So we used to get the cases only after appreciating the lesions. The farmers will appreciate only after getting the lesions. So that time also you can start the treatment. Suppose we are attending a farm, many number of animals is there. In that animals, when there is a rise of temperature, you can start the treatment.
Okay, sir. Until the animal is taking feed, we should not start giving any antibiotic. As far as my experience is concerned, we have seen a lot of cases, the cases where this until animal is taking feed, and we should not give any antipyretic also, because we are blocking the inflammatory process.
Yes, sir. Yes.
So, and there is, sir, one more question is there. What are the main chemicals released during the onset of this disease when viremia takes and this nodule formation takes? Because the anorexia develops after 5-6 days. So what may be has there been any study regarding this chemical transmitters which are released as histamine, etc.?
Mechanical transmission.
No, not mechanical. I am saying
he is asking about the anorexia. Anorexia, how it happened after 5 days or 6 days.
Okay,
it is only because of the pathogenesis. So the virus entry, and then it is affecting the other organs. So it has got the pathogenesis.
Your voice is not audible.
And as you said, chemical, the viremia sets the thing and going for anorexia. Thank you, sir. Thank you. Dr. Baba.
Thank you,
please.
Sir.
Hello, sir. Hello.
Yeah.
Dr. Baba, please.
Sir,
Dr. Baba, please go ahead.
Sir, I am Dr. Baba Buden from Davangere, sir, Karnataka. Sir, last year, when there is a outbreak of LSD all over Karnataka, at the time of only we started NADCP, that is FMD program, for vaccination all over Karnataka. This year also they are starting maybe in the next or second week of the September. So there is a disease also LSD, and we are doing FMD. Is there any that complications will occur? Is it feasible to do FMD vaccination at that right time, sir?
A very good question, sir. Very good question. I have read an article. Recently, I have read an article of OAE, published by OAE. In that, frequently asked questions for vaccinations of LSD. They have mentioned clearly. So LSD vaccines can be given for any healthy animal. So vaccines usually we will give for any healthy animal. So if it is any affected by any disease, we won't give any vaccines, number one. Number two,
Okay,
and can we use FMD and LSD vaccine at the same time or in between a shorter period? Well, definitely we can use. They have mentioned particularly this line itself, because the cow or the animal is able to produce immunogenicity for two different type of antigens, and so that we can use FMD and the LSD also. There is no doubt in that. In OA itself, they have clarified this doubt.
Sir, if the animal is under incubation period of the LSD, when we don't know the symptoms and not at all exhibiting the symptoms.
Yes,
so anyway, that FMD program is going on. If we do the vaccination for the FMD, is it the take care of LSD also?
When there is any incubation period of LSD, suppose we are using, if your question is that if you are using FMD vaccination,
right?
So the vaccination, the immunity development will be very much less. So that should not be advised.
Right. Thank you, sir. Thank you.
Yeah, thank you.
Dr. Anshul, if you want to start.
Hello.
Good evening, sir.
Good evening.
Am I audible?
Yeah, you are audible.
Okay, this is Dr. Anshul Chandel, and I'm MBSc in gynecology. I'm working as wildlife veterinarian in a zoo in Himachal. So, sir, it was a very informative talk. I have a question is there any safe method for vector control in enclosures of ungulates?
Yes. For vector control in ungulates in the closed premises, we can use, as already told, in many field conditions, the farmers, they use their huge net. They have put a net for preventing the vector control. So that can be very effectively used.
I mean, for ticks, like their eggs.
Which one, madam?
Ticks, sir. Ticks.
Yeah. We have to control the ticks and fly population. For controlling the fly population, we can put in the premises, enclosed premises, we can use the net and all, so that we can prevent the fly attraction and other things. And tick infestation and all routine management we can use. De-ticking and other management of tick infestations that we can use regularly. Control
if there is anything that we can spray in the open area, on the soil, that is safe, but not butox or deltamethrin, but anything natural or something that we can mix with the soil or surrounding area.
Yes, sir. Main thing we are using, we'll be using in the farm conditions like cypermethrin components and all, but we won't be using in other, I don't know idea about whether they are using in the zoo and all. So in such conditions, if any natural thing available, that also can be used.
Okay, thank you, sir.
Yeah, preventing the stagnation of water around the stall also so important to avoid the mosquito and other flies. Okay.
Sir, good evening, sir. This is Dr. Himita, Veterinary Assistant Surgeon, Animal Disease Diagnostic Laboratory, Visakhapatnam, Andhra Pradesh, sir. The presentation is very informative.
Thank you.
Sir, is the affected animal, recovered animal is lifelong immune, sir?
Yes. That's a good question. The recovered, they say the recovered animals are immune for a longer period. And so that the vaccination should be carried out every year.
Sir, because we have some incidences in Srikakulam and Vijayanagaram district, and we have very less vaccine. We have to choose the group of animals to vaccinate. Because in 1920, we had outbreak throughout our state. So we are choosing the group of animals so that the susceptible population will be vaccinated. No,
yes.
We are planning to vaccinate the heifers, 4 months age to heifers.
Then is a good thing.
Sir, if vaccine is full-fledged available, is it necessary to vaccinate the adult also, sir? Already.
We can. If the vaccine is available, we can use vaccines for adult also. Otherwise, the young ones and the heifer, they can be vaccinated first. And those animals which are already exposed, they will be having immunity for a longer period. And the other animals can be vaccinated, given preference.
How much longer, sir? How much time we can expect? How much longer means?
Immunity, they are not saying this much immunity like that. Literature says they are producing longer immunity, but they are recommending annual vaccination.
Okay, sir. Yes. Sir, one more doubt. in affected animal, if in one herd, one animal is affected, if there are 10 animals, can we vaccinate the other 9 remaining animals?
Yes.
At the time of infection.
We can vaccinate if the animal is, you keep the affected animals separately so that the vector transmission is being blocked, and we can use the vaccination for the other 9 animals, which is healthy, feeding habit, everything normal, you can vaccinate. But another one thing, this immunity will be produced only after 2 to 3 weeks. In the meantime, if there is any vector transmission, the disease onset will be there. That we have to take.
Okay, sir. For FMD, we are vaccinating from epicenter, no, sir, because it is transmission through these fomites and all, whereas it is transmission through ticks somewhat slow. We can control the tick population. We can control the spread, no, sir. And if we vaccinate from the epicenter, there may be chances in the herd. Meanwhile, no, sir. If we give the preference to that, some ambiguity is there in that. Can we vaccinate from outside or from the herd?
They recommend from that epicenter and the 5 kilometer radius and all. They are mentioning in the guidelines and all. Mainly, since it is involved as a vector, is believed to be a vector, or the spread of the disease is very fast. That's why.
And I mean, we can vaccinate in the herd first, no, sir, because herd will be protected. Because if we vaccinate from 5 kilometers from when we come to this actual affected herd, it will take time and may cause the infection.
Many farmers in many farms are isolating the affected animal, and they are vaccinating the other animals, and they got a good result in preventing.
Okay, sir. One more doubt, sir. The incubation period of the this LSD, that means the entry of the virus, from the entry of the virus to the symptoms.
Incubation period, they say it is around, actually it's for, they said 2 weeks, they are telling, but in short period of 8 days also it has been recorded, and it will onset the clinical signs within this period.
Okay, sir. In some literature, and I mean in net, it is like 4 weeks. Some ambiguity.
Yes. It varies according to the area conditions.
Area condition. Okay.
Shorter incubation period also there. As they mentioned, the longer incubation period is also there.
Okay, sir. Okay, sir. Thank you, sir. Thank you.
Hello, please. Hello. Yes, please.
Hello.
We are.
Dr. Gunjali, yes, sir, from Maharashtra. Very good evening.
Good evening, Prashant. Please go
ahead. Sir, my question is that can we use blood for injecting into the same animal as an autoimmunization from the initial onset of the disease, clinical manifestations, till take its or the end of its severity or symptoms? Can we use blood, sir?
I think you are asking about autohemotherapy that we are commonly using in case of papilloma and all. But in this type of LSD cases, I have not tried. I have not come across any experience of the field vets also. So I don't have any idea about that injecting out the blood. In papilloma and all, we are getting common results and all. I don't get any feedback from the field veterinarians also. I don't think.
No, sir. I tried it almost in 300 to 400
you can share
animals.
Your experience. You can share your experience.
I in 2020, I tried in almost 300 to 400 animals, including nondescript, then crossbreds, and even in buffaloes also. It has worked very nicely. I have used 0.1% solution of the formalin. Just in microliters I have used. I have taken 5 ml of blood. And added 1 microliter of 0.1% formalin in that one. And I have injected the same subcutaneously in almost 300 to 400 animals. By that time, but out of these 300 to 400 animals, there was no mortality at all, and even the recovery or the clinical manifestations were not so severe.
So no any local reactions, nothing.
No untoward reactions, except I used 0.1% of the formalin just to inactivate that all the things in the blood, say we can say constituents. But small, we can say fibrotic kind of thing or lesion, it has revealed at the site of inoculation where I have injected it.
Hello.
Yeah, subcut. That was there, but recovery. It was my personal experience actually. I tried it.
Okay, it's good to share your experience.
Thank you.
Hello.
Anyone else? We just need to conclude a little faster.
Good morning.
Hello.
Yes, please go ahead.
Good evening.
Can you hear me, sir?
Yeah, we can hear you. One person at a time.
Good evening.
Please. Good evening.
Sir, can I ask question, Dr.
Borkataria, please go ahead.
Okay, sir. Presently, myself, Dr. Borkataria from Gujarat. Basically, I am working with the Department of Gynecology, but since last week, I am deputed with the State Animal Husbandry Department in the management as well as the control of the LSDV in the Gujarat. Since last day, more than 500 animal I have examined, sir. The main challenging with the treatment is the our gear animals are supposed to be more resistant to the infection, but our cartridge cattle as well as the gear animals, we have seen more number of animal with the limb edema as well as the brisket edema, which is more resistant to any kind of treatment, sir.
Yes, sir. Yes, sir. Yes, sir. What you are telling is correct, sir, because limb edema is the most complicated one. Even ventral edema and limb edema, sometimes this limb edema will have cellulitis and it will get a wound. I have shown some pictures. That is also the complications of these things. So you can treat it with symptomatically with broad spectrum antibiotic, diuretics, and anti-inflammatory drugs for 3 to 5 days. And if you are using NSAID for more than 2 days, you just add pantoprazole also. And slowly it will regress. The lymphedema will regress slowly because the lymph node enlargement will be there. It will reduce in a few weeks. That's why then slowly it will have the aggression. There won't be abrupt reduction of the lymphedema.
Okay. Sir, second challenge we face, that is once we are giving the anti-inflammatory or the antibiotic for more than 3 days, the condition getting day by day aggravate. The most challenging condition presently we are facing. If we are using more medication, then the case is getting day by day very much aggravated or almost at the brink of the mortality.
Yes,
so in such a cases, you can use.
Sivaraman was telling, you might not have given pantoprazole along with it. Have you given pantoprazole?
Sir,
have you given pantoprazole along with the anti-inflammatory?
Sir, no, sir. We didn't give the pantoprazole.
That is the problem. Doctor was telling, Dr. Sivaraman was telling that add pantoprazole whenever you are using an anti-inflammatory if it is more than a day or two, because they may produce abomasal ulcer and it will complicate more. There you can see the occult blood and the feces also, the dung also. So that is very, very scary, and it will go worse and it will have pain in the body also. So it will aggravate the condition. That may be the reason to have the poor response in your case.
Sir, another problem is some of the animals are alert, active. Just we can see the superficial nodules. Temperature is also in the normal range, but the animals remain in anorectic phase only.
Yes, sir.
Nothing else.
Yeah. Same thing. As we are getting viral fever and we are being anorectic because of the viremic phase. So in such a conditions, if the animal is anorectic and all, is not at all taking feed and all, you can give supportive treatment with some fluid therapy. So that will be a difficult thing. Having a fluid therapy in all the cases, not at all possible thing. But you can select a few cases, whichever it is not at all drinking water and all, just you can go for a minimum amount of fluid therapy with the supportive treatment, vitamin C. And in my personal experience, I got some very good results in using alternative medicines also. That also can be tried in the field of conditions.
Okay, sir, because at that time we have used some rheumatoid medicine, but the case remains same without any program, or we didn't get the result in such kind of animals.
Yes, sir. You give some supportive therapy, sir. So give some supportive therapy, vitamin C, B complex, fluids. so that the animal will slowly recover from the viremia cases.
Another challenge, sir, in the current field is presently the most around 10 to 20% animals are in such a condition that there is concurrent infection of the hemoprotozoon, specifically the thalariosis.
Yes, sir.
And when we begin with the treatment of such kind of condition, then sir, I don't know exactly, but because of the hepatic stress or else the condition is getting aggravated day by day.
Thalariosis, usually whenever there is a stress or whenever there is immune compromise, definitely thalariosis get flare up. So in such a cases, we have to clinically identify very few cases. Individually, very few cases will be coming across in that. So whenever daily when you are examining the animal, see the mucous membrane and the sclera. The scleral vessels are very much congested and the mucous membrane is very much pink and moist or not. That we have to monitor daily. And in complicated with the thalariosis, that definitely the mucous membrane will become pale or ectric in nature. So accordingly, we can change the line of treatment so that we can save the animal. Daily monitor the mucous membrane and the scleral vessels, whether it is congested or not, whether it is normal or not. Heart rate. So it will be difficult to see in all the cases, but when we have a triage, some selected cases which are not responding to our treatment, just to see the heart rate and the mucous membrane. That will give some clue so that we can plan this special treatment for those animals.
Sir, another thing that is in some of the animals with the normal range of temperature, we are getting the cases of the epistaxis.
Yes. Epistaxis, because of the nodular lesions, serosanguinous discharge and epistaxis may be also there. So you can use the styptics commonly used. You can use the tranexamic acid and all the bothrophase, adenocorm, monosemicarbacein. That also you can use.
Okay. So apart from that, there is chance for getting a reduction in the platelet count.
Yes,
also can lead to epistaxis. So your case may be a serious case with low platelet. That may be the reason to have the epistaxis. So that may be if you give fluid and supportives, definitely it will improve. Thank you, doctor, for your valuable information and interaction.
Thank you. Anyone else, please?
Sir, I want to supplement with the vaccine.
Yeah, please go ahead.
Hello.
Yeah, please, Dr. Bharat, please go ahead.
So the government of India, the guideline is there. We have to use the 10⁻³ TCID 50. So there is no question of ml. So the vaccine, if the vaccine 1 ml is contained the 10⁻³ TCID 50, so we have to use 1 ml. Because the manufacturer, they don't have the data regarding the 1 ml or 3 ml. So we have to follow the government of India's guideline. And also there are many published articles. They are also saying that there are 3 articles that I come across that they have used the TCID 10⁻³ TCID 50 and they give also the good protection. Just I am talking regarding the goatpox vaccine.
Yes.
Right. Thank
What
you,
you are
Dr.
telling is correct, sir. Exactly correct. Thank you.
Thank you, Dr. Bharat. You being a microbiologist can add on to it better. So we are physicians, so that's why. Thank you, but anyone else, please?
Hello. Yes, sir.
Yes, please.
Yeah. So Dr. Mohammed May, I'm from Maharashtra. Right now, I'm handling 2 cases of LSD. So I just want to ask one question, sir. Can you justify the use of injection retinol and injection Stimvet as an antioxidant and immunomodulator, along with chelated mineral mixture supplement orally? So will these medications and mineral mixture simultaneously improve in enhancing the immunity of the animal?
Yes, sir. Levamisole.
Oh no, he's talking about
injection.
He's talking about antioxidants and vitamin C and minerals and all.
Retinol.
Yes, sir.
Retinol and injection Stimvet.
Yeah. We are saying that all chelated will help you out. Vitamins will help you out, especially for the antioxidant action.
Okay.
Anyone else, please?
Hello.
Yes.
Hello.
Yes.
Good evening, sir.
Dr. Rathod, please go ahead.
Yes, sir. I'm Dr. Dilip Rathod. Good evening to all of you, sir. My question is there any guideline for the sampling plan of the LSD? Means how many samples should be taken from each epicenter? As we are receiving here many samples from the field, and we have to process and send to dispatch to Nishad, Bhopal. So is there any guideline for the same sampling plan, sir?
Any guidelines?
Sampling.
Okay. From a particular place or any other?
Means how many samples should be taken from one epicenter?
Oh, one epicenter like that. So I don't know about the guidelines, sir. Just when you are having suppose we are having a work in the area, suppose in our jurisdiction, suppose there is an outbreak of disease, you can collect some samples, few samples, and you can send it for recording purpose. There is no specifically this much of samples we have to collect and all. That we have to verify until. I don't know about the clear instruction. How many samples we have to collect from the epicenter?
The random
selections.
Hello, this is Dr. Milind.
Yeah, Dr. Milind, please go ahead.
Just to control the spread of LSD, what can be the best liquid or whatever alternative to be sprayed on the body of animal? Since Dr. Sivaraman told that an enormous amount of a load of virus is present just in the scabs or in the nodules. Secondly, virus is susceptible to sunlight, phenol, and even sodium hypochlorite, which cannot be sprayed on the animal body.
Yes, sir. Yes, sir.
There some solution recommended which can be sprayed on the animal body even while the animals are being taken out for the grazing. So the flies, particularly, which are the important vectors to spray the disease, can be controlled.
So usually for fly control, we are as a clinician, we'll be using cypermethrin, deltamethrin and all to prevent the fly attractions or tick infestation or any other ectoparasites. But in affected animals, we cannot able to apply all these things. So to prevent, your question is very good, to prevent these things from attracting the flies and getting transmission being prevented, you can apply the ethnoveterinary preparation so that it will reduce the fly attraction so that the transmission of disease will be reduced from the affected animal to other animal. And the healing process also will be enhanced.
Thank you, sir. It was
Sir. Good evening, sir.
Yeah.
Good evening, Dr. Akram. You have been waiting for long, so please go ahead.
Sir, my name is Muhammad Mashood Akram, and I am final year student of Gomal University, Dera Ismail Khan, KPK, Pakistan.
Okay.
Sir, my question is about that vaccine is a pre-file year. What is your expert opinion about serum therapy in infected animals?
Serum therapy, clinically, I have not come across any experience sharing with the veterinarians. I don't have any idea about serum therapy. I have not done anything.
Sir, I experiment.
Yeah.
Okay, sir. Sir, I inoculated a serum of a recovered animal to infected cow. The route I used was intravenous. The outcome was tremendously satisfying.
Okay.
Within 24 hours, the nodules started to depress.
Okay.
And sorry, sir, my English is a little bit weak.
Okay, no.
And that's why I'm facing a problem. Sir, but after 2 or 3 days of bursting of already present nodules, the new nodules appeared on the skin of that cow, sir. So what's your opinion about this? And I am asking about the best route because I was afraid that intravenous can cause reaction. So I should go subcutaneously or intramuscularly.
Yeah, regarding your question of serum therapy, I have not come across anything in my practice, and I have not seen any literature also. And also, I have not got any feedback from the veterinarians. For example, many other conditions, for example, in wart and all, we used to have autohemotherapy, injecting blood and all, we are getting very good result. So we can say authenticately. But in this aspect, I don't have any idea about the serum therapy. I have not tried about it. And regarding the presence of the nodules, small nodules and bigger nodules, they will be present according to the, after the viremic phase, they will be starting in the phase manner and they will develop one by one throughout the body region.
Sir, I think viral load.
The serum therapy.
Sir, I think viral load matters a lot in this case. A case I was dealing that showed very good result of serum therapy, because there was because that animal was quarantined. That showed a good result, sir. And sir, the second question is about the mechanical transmitters, that about fly and ticks. Sir, I used cypermethrin on the animals whose nodules are not brushed, but the cypermethrin cause irritation in brusted nodules. So I used Nagovan a little bit in povidone solution for that nodules. Is it?
Yeah, you can use, and also in the rusted nodules, you need not use the cypermethrin. You can use the alternative medicines, chestnut preparations. That will be safe.
See, unless you have more number of scientific research in your serum therapy or anything, we cannot give a correct, exact outcome of it, because it's all your experience. It has to be proven scientifically. Then only we can recommend. So we don't have any experience, and even Dr. Sivaraman had never had any experience out of it. So it has to be proved by scientific research. Then only we can take it into account. Thank you.
Thank you. Anyone else, please? Dr. Malhotra? Dr. Samir?
Okay.
Okay.
I'll finish stuff. Okay, thank you, Dr. Sivaraman, for your wonderful, great speech regarding lumpy skin disease, which is very much needy for the hour. So I hope most of our vets in India and other countries, they got benefited out of this. So they can have an idea how to approach, how to manage the severity of the disease. So in near future, we'll be having commercialized LSD vaccine itself. So it will solve many of the problem. So thank you very much. Thanks for your very good presentation. I sincerely thank you. Thanks for
Thank you very much, Dr. Narajan sir, my teacher, my respected teacher, and also in the occasion of Teachers' Day. Thanks to Narajan sir, President Association of Veterinary Dermatology, for giving me the opportunity to share my small clinical experience regarding the lumpy skin disease. And also I thank Dr. Nitin Bhatia, Intas Pharmaceuticals, for giving the platform for conducting this webinar. And I also thank all the field veterinarians who have participated, and we have engaged in a very good conversation. They have shared their experience and their different type of clinical science and their questions. And it was very interesting for more than 50 minutes discussion. And I thank one and all for this wonderful opportunity. Thank you, sir. Thank you.
Yeah, we thank everyone.
Thank you. Thank you.
We thank everyone out there. Thank you. And we close the session. Thank you.